initially you might see a child and give them maybe like an interim diagnosis. Why might that change as time goes on?
There's a few reasons. Sometimes a child might have experienced a really significant event or events. So, for instance, a child who'd had a major physical illness, or a child who had moved from living with their family to living with other caregivers, and they might present with what's been withdrawn, not using the same amount of language, really struggling with the way they regulate their emotions. For a young child like that, even if we saw also quite clear features of autism, it would be best for us to just wait and let them think again about it when they were in a more settled environment. There are sometimes what happens is that there are autistic features that are really clear in one setting, but not seen at all in another setting. And one of the inbuilt diagnostic tests in our system is time. And so as little children's brains are continuing to grow and develop, sometimes I like to just see how they grow and develop before we sort of look at is this primarily a problem with the way they process cognitive information? Is this about their way we use the term intellectual functioning, or is it predominantly around how they process sort of sensory information and social communication and things, in which case we might think more about autism. So that's the main reason why we'd use an interim diagnosis. I think the problem with it is that because of delays within our system, you can end up with an interim diagnosis for longer than we intended. The most common one we would use is a term called global developmental delay. Yeah, and that's it's even global developmental delay is a diagnosis that covers a wide range of differences in development, and it allows a child to access support through the government, through needs assessment, which in Canterbury is Lifelinks, until they're sort of 8 years of age. And so that's, I guess our system almost permits us to use an interim diagnosis.
And waiting doesn't also mean waiting and doing nothing in the meantime. It's still waiting and working with them, supporting the child and giving them what they need, regardless of what the terminology is used around them. It just can sometimes then provide a bit of clarification as they get a little bit older.
The other thing that's really neat about living in New Zealand is, or in Aotearoa, is that you don't have to have a diagnosis to be able to access support from a child development service or from the Ministry of Education Early Intervention. So whereas some other countries you have to have a confirmed diagnosis to be able to access early intervention, but we're really lucky in Aotearoa that you can access intervention as part of the journey, and I like that aspect of it.